Hey guys, welcome to Vet Candy. I am your host, Dr. Julio Alonso. Let's talk Vet Med.
This program is brought to you by Elanco Animal Health, makers of Ultra Duramune vaccines.
Hi, I'm Dr. Moore, and welcome to my TikTok. You don't just have to be deep in the woods to find ticks carrying Lyme. Due to the urbanization of deer and mice that ticks feed on, ticks can increasingly be found in cities. That's why it's essential for pet owners to stay one step ahead of the spread with an annual Lyme disease vaccination for their dog. Stop Lyme before it starts.
Researchers have developed a rapid paper-based test that can diagnose Lyme disease in its early stages in humans. After a day hiking in the forest, the last thing a person wants to discover is a tick burrowing into their skin. Days after plucking up the blood-sucking insect, the hiker might develop a rash resembling a bullseye, a telltale sign of Lyme disease. Yet, not everybody who contracts Lyme disease gets the rash. Now, researchers have devised a blood test that quickly and sensitively diagnoses the disease at early stages. However, 10 to 20% of infected people do not develop the rash, and existing diagnostic blood tests are slow, costly, or insensitive at early stages, when treatment is the most effective. The researchers built a handheld, paper-based device to detect antibodies against the B. burgdorferi bacteria in serum samples. The device included a sensing membrane that contained several spots covering 7 bacterial antigens and a synthetic peptide. Antibodies from serum samples that attached to the spots were detected with a solution that changed color depending on the amount of antibody captured. When tested on 50 blood samples from people with or without early-stage Lyme disease, the assay had a specificity of 96.3% and a sensitivity of 85.7%. In addition to being much more sensitive than existing tests, the assay requires 15 minutes to complete and costs only 42 cents per test. Let's hope this test can become available for our clients. Now, let's hear from an expert.
Hi, my name is Melissa Evans. I'm a licensed veterinary technician and a veterinary technician specialist in emergency and critical care. And I'm going to give you tips for talking about Lyme disease with your clients. The geographic range of Ixodes scapularis, the tick that carries Lyme disease, is expanding. Lyme disease has been detected in all 50 states, and the number of cases continues to rise. That's why, more than ever, it is important to talk to your clients about how to protect their pets. Here are some tips for talking about Lyme disease with your clients. First, tick control. Year-round tick control is a critical recommendation for reducing Lyme disease and many other tick-borne diseases. Owners should be informed that transmission of the bacteria that causes the disease usually happens 24 to 48 hours after the tick attaches to its host. So, prompt tick removal and daily tick checks are important for preventing the disease. Maintaining a clean yard that is free of heavy vegetation and debris is also a way to reduce tick populations at home. Second, vaccination options. Annual vaccinations to prevent Lyme disease are a great option for dogs that are at risk for disease, in addition to tick control. Vaccination serves as an added protective measure. For more great tips, follow me on Instagram.
Let me tell you about this cool veterinary student. When Juan Orjuelan, aka Juancho, was a child, he dreamed of entering veterinary school. Unfortunately, everywhere he looked, it seemed this road was an impossible one. There were no Latino veterinarians to look up to and emulate. His family and friends told him not to bother trying. Even those who meant to encourage him simply told him he'd get in on the benefits of being a minority and nothing more. These hurtful words might have deterred many other aspiring vets, but Juan only became more determined to get into vet school. He started walking dogs in 3rd grade in order to start earning money, started handling and showing dogs. Eventually, Juan's hard work paid off and he was able to attend vet school, only to discover new problems in the path. Not only were there few to no students like him, but also no way to express his sexual identity as a gay man either. He decided to make a change and co-founded the Latinx Veterinary Medical Association, or LVMA. The association itself has already helped make diversity and inclusion a focal point in the industry by bringing together veterinarians and students around the world and helping to provide a network, scholarships, and guidance for vet students and new vets. It's a big help to those who may have previously thought vet school was out of reach because of their race, or simply not knowing what path to take in order to get there. You can follow his journey on Instagram at Juancho the Vet Student. Let's talk about healthy eating. Mindful eating brings mindfulness to choice and the experience of eating. Mindful eating helps us become aware of our thoughts, feelings, and physical sensations related to eating, reconnecting us with our innate inner wisdom about hunger and fullness. Here are some great tips from registered dietitian nutritionist Kiarie to start eating mindfully. First things first, clear your minds of all the preconceived ideas you have surrounding types of foods and the associations they conjure up for us. Next, think about what your body is feeling in terms of hunger and how much food it might actually need. It might be a salad, a burger, a chicken dish, pasta, or maybe even just an apple. Be sure that you are free from inappropriate distractions when you're beginning to eat. This means no texting, TV watching, talking on the phone, or reading emails. Not only is this crucial for your own mindfulness practice, but it opens up the awareness for you to connect with your family or friends during meals. Appreciate the aroma and appearance of your food as you reflect on the tastes, textures, smells, and colors. Some will even find it useful to contemplate the origins of their food to help them connect to the taste and satisfaction gained while consuming it. When feeding children, it is always a great idea to talk about these aspects of the food and provide some education about how it was grown, made, or cooked. Once you're about halfway through your meal, take a moment to pause and consider how full you are and whether you need to keep eating. All too often, we eat the portion in front of us rather than the amount our body really requires, which is, as we all know, will lead to weight gain regardless of whether the food was healthy or unhealthy in our minds. Thank you for watching Vet Candy. I hope you enjoyed our show. Stay up to date with everything VetMed by subscribing to our channel. You can also follow us on social media at MyVetCandy.